sodium hyaluronate gel, and Chitosan, are effective in preventing postoperative peristomal adhesions after defunctioning enterostomy. Peristomal adhesions complicate closure of defunctioning enterostomy. The efficacy and safety of sodium hyaluronate gel and Chitosan in preventing postoperative adhesion have not been extensively studied. They are the common complications following the colorectal surgery. This study aimed at the evaluation of safety and efficacy of the anti-adhesions such as sodium hyaluronate gel and Chitosan in the prevention of the post-surgical complications. This was a prospective randomized controlled study. 114 patients were enrolled in the study. The patients who were selected for the study had more than 18 years. They were the patients who underwent colostomy, with or without bowel resection. Patients who had allergic constitutions, who were undergoing colostomy, pregnant patients, and who were on the use of immunosuppressants, were not eligible for the study. 38 patients were assigned to sodium hyaluronate group, 37 patients were assigned to Chitosan group, and 39 patients were assigned to control group. The patients in the control group were without any anti-adhesion agents. Patients' limbs of enterostomy in sodium hyaluronate gel group and Chitosan group were smeared with sodium hyaluronate. All patients received standard care and were kept blinded to their treatment assignments during the study. The follow-up was scheduled to 2nd or 3rd day, 7th day, 30th day, and 12 to 24 weeks after the surgery. These outcomes were evaluated accordingly. The two outcomes were evaluated for knowing the significance of the results. Data were analyzed on an intention-to-treat basis. The sample size was calculated by using SAS software. SPSS was performed for analysis of the results. The baseline characteristics of the 114 patients included in the study. Age and gender did not differ significantly among the three groups. The majority of the patients had an underlying disease of colorectal cancer. The mean age was 50.3 plus or minus 15.61 years in sodium hyaluronate gel group, 53.0 plus or minus 15.79 years in Chitosan group, and 51.10 plus or minus 14.30 years in control group, with no significant between-group difference. There was a slight male preponderance in the control group, but the difference was not significant. Duration of hospitalization after enterostomy did not differ among the three groups. Patients in sodium hyaluronate gel and Chitosan groups were less likely to develop dense adhesion than those in the control group. Post-hoc analysis showed marginally significant difference between the sodium hyaluronate gel group and the control group, and significant difference between the Chitosan group and the control group. Our results showed a comparable safety profile of these two anti-adhesion agents, and that incidence of adhesions appeared to be lower with these agents, albeit not statistically significant. Compared with control group, without any anti-adhesion treatment, the severity of postoperative adhesion was significantly decreased in sodium hyaluronate gel group and Chitosan group.